This is Dr. Babak Azizadeh. You are listening to the Smile Podcast, where I will be sharing with you my unique and holistic perspective on beauty, health, and wellness. Hello. Millions of people have surgery every year.
Or you could just get a boob job.
Using targeted Botox can be a miracle.
Smiling like that is a skill.
Your surgery has been successful. Hello, everybody, and welcome to the Smile Podcast. I'm Dr. Babak Azizadeh, and we are continuing our Zoom podcast with a very, very, very special guest, Dr. Neda Shamie, who is not only one of the top ophthalmologists in the world, but a dear friend, and we've known each other since our college days. And welcome, Neda, and thanks for coming on.
Thanks so much for having me, Bob.
So we not only are really great colleagues, but really great friends, and we have been for the last several weeks talking about coronavirus and its impact on the eye and ophthalmology, the practice of ophthalmology. Before we get into that, Neda, tell us a little bit about kind of your background so that, you know, our audience can know a little bit more about you and get to know all the wonderful things I already know about you.
Sure. Well, a little bit for your audience. I have known Dr. Azizadeh since as long as I've known my husband. He and my husband have been friends since a very young age, since 10 or 11. And we met in college when I was a sophomore in college, and they were seniors. I know I look much younger than he does, but
yes.
Thanks to him and the Botox and the fillers, I look this young. So we've known each other for many, many years. I went to UCLA, obviously, for my undergraduate training. Well, that's my dog, and somehow he...
Hi! Hi!
That's both. So I went to UCLA for my undergraduate training, and then UC San Francisco for my medical school training. I then came back to UCLA for internal medicine, and then went to UC Irvine for ophthalmology. Did an extra year.
One of the top programs in the country.
Yeah, some of the best programs. I was very lucky. And then I did a fellowship year for laser refractive surgery and corneal transplantation. And then after that, have kind of as you know, moved around for the best jobs, for jobs that allowed me to really grow professionally. And thankfully, my husband also, who is an academic surgeon, we were able to find opportunities that really helped us both grow in our own careers. So I went to Portland, Oregon, and worked with one of the pioneers in eye surgery, Mark Terry, at a center called Devers Eye Institute, and was there for many years. And then came down to USC, where my husband and I both were lucky enough to get recruited together to join the department, and was on faculty there for 6 years. I was the director of the Eye Center for USC that started in Beverly Hills. I actually was involved in starting that process, and turned a lot to Bob for advice on how to start a practice, if you remember those.
Oh yeah, locations, right? Where to go, what to do.
Yeah. Yes, free consultation.
Yeah.
But and then after that, I have now joined Robert Maloney at the Maloney Shamie Vision Institute, which is really a premier center in the Western United States for eye surgery. I joined him as a partner, and it really was a move for me to grow further in my own practice and really focus on what I love in ophthalmology, which is surgical practice and surgical specialty. It's a fantastic practice, and we'll talk about it more about the kind of things we offer.
So Dr. Shamie and her husband are like the power couple of medicine. They are like just so accomplished, so amazing, and I'm so lucky I know them. And Dr. Shamie and Maloney are the power couple in ophthalmology. So that is really, really amazing. And Dr. Shamie is very humble, but she is like, speaks all over the world. She's a key opinion leader for many, many aspects of ophthalmology and in both the academic and industry. So she is like really sought after, and we're lucky. Thank you for taking your time to spend, with us a few minutes to really, what I wanted to do, obviously this is a beauty, health and wellness podcast. We're going to really focus on health and wellness today, especially with the coronavirus, because obviously there is so much information, and the key aspect, what I want to get to is real science, real facts with coronavirus as it has to do with the eye. And there are certain aspects that we've, like, over the past few weeks, everything's gotten shut down in terms of practice of medicine and so forth. So I want to get into a little bit of that and how that may also long-term not be the best thing for some of our patients. But before we get into that, what do you, from an ophthalmology, from an expert ophthalmologist who deals with, diseases of the eyes and understands the anatomy of the eyes, what are the key things that we need to know about, transmission with the eye and the diseases that it could potentially impact with the coronavirus?
Great question. As we all know, the impact of coronavirus on the respiratory system and the common symptoms being, fever and cough and chills and such, and more flu-like symptoms. What we know about its impact on the eye comes from the Chinese data from their initial series. And what we know, at least has been published or reported, is a very small percentage of patients also had conjunctivitis. And that is like pink eye. Now, how often was it associated with coronavirus? It was one of the rare findings or associations, but it also makes you wonder if when your attention is towards saving someone's life, you're not necessarily checking their eyes. And so I don't know, I think we'll have more data. We have not seen any patients in our clinical setting that have had pink eye and associated symptoms that were suspicious for coronavirus. Now, you would imagine that if someone is having pink eye, they may be, waiting it out and not wanting to go in. And if it is associated with coronavirus and the coronavirus becomes symptomatic, they're not going to be coming to the eye doctor with a pink eye. They're going to go to the hospitals. So we don't know. Short answer to that is that we don't know. What we do know is that we need to protect ourselves against the potential transmission through the tear and through conjunctival transmission. If you touch your eyes, for example, and you have coronavirus, touch your eyes and your tear gets on your hand. With that hand, you touch a surface. Could you potentially transmit it to someone else who touches it and touches their face? Yes, potentially. So the short answer to your question is, what we've advised everyone is, clean your hands before you touch your mouth, nose, or eyes. Yeah. And that is regardless of where you think your hands have been. I think the assumption should be if you're going to touch your eyes, if you're going to rub your eyes or touch your nose or your mouth, make sure you wash it or clean your hands, sanitize it before you do that. It becomes a little complicated if you wear glasses and you want to keep adjusting your glasses and such. And those scenarios are a little tougher, a little more difficult to make recommendations because it becomes so habitual for people, or it's habit. If someone has allergies, they're constantly rubbing their eyes. So general advice is just try not to touch your eyes and don't touch your mouth and nose and just your face generally without clean hands.
Now, as we turn, like for us as doctors, we're going to be, soon going back into doing surgery and being involved and being in a setting where we're going to have potential exposure. And some of the concerning aspects, and this is my own curious question to you, is, we talk about aerosolized viral transmission. So for instance, if someone sneezes, when patients are getting intubated, we know certain scoping mechanisms can aerosolize, and that it's almost like a vapor of virus that's in the air. If someone's not having eye protection, which most of the masks are just covering noses and mouths, how easy do you think that can get transmitted if it's aerosolized, the virus, through the eye and through conjunctival transmission, or is that something that you think is a relatively low risk if you're not touching it?
Yeah, I would say it's a very low risk. I mean, it gets diluted with the tears, and viral transmission through the eyes, it just historically has not really been the source of systemic transmission. Could you potentially develop conjunctivitis in response to the COVID and then rub your eyes if they're red and then eat something with your hands that are dirty? Yes, I can imagine then you self-transmitting the infection. And again, this is not based on science, it's just based on my own late night, middle of the night, not being able to sleep thinking about all the different ways that I need to protect myself and then tell my friends and family and my patients how to protect themselves. We're making assumptions based on historical experience with other things. So I think in general, I would say if someone sneezes, you'll have a higher chance of catching it by breathing it in, or it landing on a surface where you then touch and eat with dirty hands than you would by it hitting your eyes. But if you have conjunctivitis, if you have pink eye, make sure that you don't use the same towel as your someone else you live with. And that's regardless of COVID, because pink eye is very contagious. And make sure you don't wash your eyes, eat with dirty hands. So wash your hands and such.
And we have an immune system in the eye, right? That's why we don't get a lot of eye infections. Can you tell us a little bit more about that, or remind me? Because I'm like, wasn't there some antibody that's always present in the eye? Or
yes, now you're really testing my knowledge.
Was it IgA? Is it an IG something?
Changed,
IgD? It was one of the immunoglobulins in there. See?
Yeah, it was.
That's what we get. This is now we're getting into the nerdy. This is like that TV
this
show.
This is how I remember you. This is how I remember you from UCLA, from undergrad.
the nerdy.
When I thought I knew everything I need to know, Bob comes along and asks the question that makes you realize that you don't know everything you need to know. So yes, there is. I'm going to try to sound intelligent here. Yes, there is an immunological reaction in the eyes, and there are antibodies and antiviral, reaction in the eye. But I think, again, the key is, even systemically, it comes down, my own impression is that it comes down to the load. So how much exposure you have and the entry of that virus into your systemic, system. And which is why anesthesiologists are greater risks, because when they're doing intubation of a patient who may be a silent carrier of COVID, even if they're not so sick that they're symptomatic, that aerosolization or the exposure is a lot more. Actually, ophthalmologists have also, in Italy, for example, and in China, the first person who, was the one who talked about coronavirus was an ophthalmologist who unfortunately passed as a result of complications of COVID. So it's very, very, very clear in our minds, and it's a real source of anxiety for us ophthalmologists, as it is for ENT doctors, and of us who have to be very close to the patient, and we can't follow the 6 feet, distancing. And so, yes, there is a way of transmission through the conjunctiva potentially, but it's not. I don't believe, and I don't think there's enough science out there to point at it being a prominent source of transmission.
Good. Just as a side note, Dr. Shamie, her at that time, friend and my best friend, Dr. Danishman, and I were all microbiology and molecular genetics major, which is the basically coronavirus major essentially at that time, and we were. So
that was 20 years ago. Actually,
longer.
God, that was
years 30 years ago.
Oh my gosh.
For me. Yeah. So we'll get nerdy once in a while. Okay. So now, we're about to embark on getting back into our practices. Okay. But before we get into that, I believe there's also been some harm to patients, because patients are so scared to go to the ER or call their doctors because they don't want to get coronavirus, and they have there was a study that the number of people, young people or middle-aged people dying from strokes has gone up. Heart attacks has gone up because they're just so worried about going to the ER. Are there any ophthalmologic emergencies that people should be aware of? That, look, you cannot take this. This is something that you got to go to the ER or call your ophthalmologist, because it's a matter of hours before you can, really get into trouble.
Yeah, very good question. Ophthalmology emergencies. Let's talk about chronic diseases that need to be managed routinely,
Right.
such as glaucoma and macular degeneration. Those are sight-threatening conditions that, if they are not monitored on schedule, potentially, have a detrimental effect on retinal And so patients with macular degeneration who have been getting treated on a routine basis should definitely speak to their retina specialist and ask for what the schedule should be. And I'm not a retina specialist, so I don't know what modifications have been made in those treatment protocols. But like a macular degeneration patient who is getting injections to prevent worsening of the macular degeneration on a monthly basis, they may probably be able to stretch it out, but again, a retina specialist would be able to give guidance on that. A glaucoma patient would need monitoring of their intraocular pressure. Usually, if you're controlled and you've been controlled prior to the COVID, you could probably stretch out the monitoring to every 3 months or every 4 months, again, under the guidance of a specialist. But if you were, for example, at a point where you weren't yet controlled and your pressure was being monitored more closely, then I would, highly advise against not going in, because you could potentially lose your vision if you avoid going in. And, as physicians, we've all taken major steps in making sure that we protect our patients and protect ourselves, and we closed the clinic to essential visits, but those patients who need close monitoring, there are ways of going in safely. Now, there are doctors, though, who have closed their clinic altogether, even to urgent or emergent cases. And usually those offices, though, have an alternate place for the patient to go to. So I would say, if you had an appointment and you feel that you have, chronic glaucoma or macular degeneration, or you have it, you should definitely call and find out what the next step should be. Other things that can happen emergently, where you didn't have a problem and then all of a sudden you're having vision problems, like loss of vision or flashes of light or floaters. Those could be indicative of either retinal detachment, which is an emergent problem, or potentially a vascular event, like a blood clot to the eye. Those are emergencies. And those, again, if you have an eye doctor, you should go see your eye doctor. Safer at the eye doctor's office than the emergency room. But if the eye doctor is closed, maybe call another eye doctor, or ask your own eye doctor for advice, and then ultimately the ER. I tell you, though, the emergency rooms, they are incredibly prepared.
Yeah.
It's incredible.
Yeah.
I think in California, we're very lucky. In Los Angeles, we're really, really lucky in that we haven't had the kind of surges that they had in New York. And so, for example, my husband, who's at USC, he actually says that the hospital is about 30% empty, because what's happened is that the hospital has really not turned away patients, but has given guidance to patients who are not urgent to stay home and to open room and space for COVID patients. And then COVID patients are entered in a different entry point. ERs are split up into COVID versus non-COVID. So I would say the last resort, going to the emergency room for eye emergencies, but at the very least, if you feel like you're having sudden vision changes, you should call your eye doctor, or call an eye doctor locally and see if you can get into them.
Yeah, some insider info for those of you who are listening and viewing this. It's really important to have an internal medicine doctor that is well connected and accessible. If there's one thing to learn from this coronavirus, I think that is, if I were to give you one advice, is have an internal medicine or a family medicine doctor or a pediatrician for your kids that are accessible. If they're not accessible, you should look for other doctors, because right now is the time that if, for instance, you have an emergency eye issue and you could call your internist and say, look, my eye, this is happening. That's a 2-minute discussion. That doctor, they should have a network of physicians that they can reach out to and say, okay, you're going to go to this ophthalmologist office to see Dr. Shamie in 1 hour or in 30 minutes, and they're going to see your eye. That is how I think the medicine that we're practicing will change, because people don't want to go to the emergency rooms. And way after coronavirus has changed, people are not going to want to get their routine or urgent care that they can get outside of the hospital within the hospital system. So this is really, really important. I don't know if you have any comments on that, but this, I feel like emerging change.
Yeah, absolutely. And I think the other thing that's emerging and that we've implemented into our practice, and I know you've done it even before because of your international patients, but it's virtual medicine, and it's very safe to contact your doctor. And for those doctors who have the capability to offer virtual visits, to have a virtual visit and say, this is what's happening, or ask your questions and get guidance. But that's not necessarily for emergent scenarios, but in cases where you have a question about urgency of your eye problem, that could be potentially one way to get advice and recommendations.
But yeah, but if you feel like there's something missing, like you have a change in vision, you have chest pain, you feel like, oh my God, I'm slurred, you have to call 911. You cannot be like, well, I don't want to go to, the ER to get coronavirus. The chance of you getting a coronavirus is going to be far, far, far lower than you having some long-term problem if you're not going to the hospitals and so forth.
If you're going to the grocery store, you're at higher risk than going to the ER.
The ER has, yeah, exactly. So, Neda, how do you foresee, and you kind of touched upon it a little bit, virtual consults and so forth. How's the flow going to be? Someone coming into your office, what do you foresee is going to happen so they feel safe coming to the doctor's office? How are you going to implement some changes? And I know it's changing as we speak. Every day there's something new coming up. But how are you going to do that? And how are you going to resume back to doing surgery? You do amazing corneal surgeries. You do LASIK. You do cataracts. You do all these amazing advanced and routine care that people need. How are you going to get back to that?
Yeah, I mean, it's interesting. Very timely question. We just had a meeting this morning, 4-hour-long meeting with my team, just talking about exactly those steps. I spent all day yesterday and Saturday writing up SOPs or just standard operating procedures on how we're going to do this to not only give our patients the real sense of safety, but also our staff, because our staff, you can imagine, are anxious about the possibility of coming back and what risks they're putting themselves in. So things will need to change. We are actually really excited about the silver lining in all of this, where it forced us to think about how we can become more efficient. There's so many inefficiencies in medical practices that had just stayed on and maybe had even become more inefficient through the years, just simply because that's how it's always been done. Yeah, and what, as an example, the whole check-in process of how many times have you gone to your eye doctor and you sat there in the waiting room and layers after layers of paperwork, much of it redundant paperwork. What we're going to, for example, do to combat that issue is essentially have it all digital and make sure that the patient has filled it out. And I think patients will be motivated to get that done because they want to minimize the amount of time they sit in the waiting room next to someone else. And so we're going to require the paperwork to be filled out ahead of time. We're going to do a lot of the counseling ahead of time before the visit. So there's going to be a lot of this type of Zoom meetings or video meetings of those steps that don't require a direct exam of the eyes in our case. We're going to also, everyone's going to be wearing masks for a long time, I think. We are going to be wearing medical grade masks. We're going to ask our patients to be wearing masks. If they don't have it, we're going to offer it to them. We're putting shields up in our clinic anywhere where there would be less than a 6-foot distance between the patient and the front desk, for example. And it's unfortunate, but I think it'll give both the staff and our patients a sense of safety. Our exam process will become more streamlined, where we're going to lessen the number of tests we do. And again, this will be to the benefit of the patient and to our clinics and our processes. Do we really need every single test? And we literally sat there today and talked about these tests that we do, and we put patients through 5 different diagnostic tests. Yes, it seems really futuristic and modern and amazing, but do we really need the value of the data that comes out of that? And it's interesting when you sit down and talk about it, you realize, well, some of it is redundant, and is it really useful for every patient? So we're shortening that whole process, and then during the exam, again, we're going to spend less time in unfocused discussion and a lot more time with having patients come in empowered with the information ahead of time, so their questions are thoughtful and very directed. And then we're going to end with a link to information videos and content that will be specific to their condition.
Digital, so less blending of the digital with the personal.
Absolutely. And I think before we used to kind of be down on the idea of using digital in medical care because we felt that the face-to-face was so critical in that patient relationship. But I feel like this time, during this last 6 weeks, we've learned that we've gotten used to having very kind of personal interactions with people on video. And that like you and I have been friends, and we've had a friendship long-standing. And I actually do really enjoy these video conferences that we have. I feel like, it expands on our friendship. And with patients, I have found it to be really actually intimate in a sense. When I have a patient that I'm doing a teleconference with, and they're sitting in their living room, and their dog, like my dog, came in, and their puppy is sitting there. It's incredible.
It's unbelievable.
And then their daughter or their husband helps with the discussion and asks the questions, and they feel like they're in on the consult. So
there's definitely positives. The other day, I had a consultation with actually a patient who lives a Zoom consultation with someone who lives in Los Angeles, but their dermatologist who had referred her to me wanted to be on the conversation, and with the permission of the patient, it was exactly like this. The 3 of us were talking. The dermatologist was asking questions. Patient was, and it was just such a interactive and positive, discussion that I was like, that would be amazing if I'm referring someone, to a doctor, and how great would it be if I could help my patient, help them make the right decision by being more knowledgeable. So it was really, I think there were some changes, but in the past, I think regulations have been really difficult. I think that's why the digital world wasn't, taking on. Some of the doctors who bill insurance and, they can't do videos because they couldn't bill for those charges. So those will all change and improve upon over the next.
Well, it's interesting. I thought that too. And that was always kind of my own personal excuse for not offering virtual or not even exploring it. But in exploring it now, I realize that the coding and the ability to bill was put in place in 2015. But it wasn't until we were forced to consider it that have we thought about it. So we're actually are going to add this as a permanent part of our practice, where we're going to offer the option to patients, and it's going to help us expand the scope of our practice. It'll help, especially in Los Angeles with traffic. If a patient wants to come in for LASIK consultation, for example, much of that initial consultation for a LASIK patient is talking. It's less about the exam and much more about talking about the options available. So we're moving towards offering virtual consults for LASIK consults to expedite that process for the patient, and then gathering information ahead of time, and then have the patient come on the same day as their LASIK. imagine going from 2 or 3 visits to one visit, only one virtual visit, and then one visit for the surgery.
Yeah.
A lot more efficient. The patient can do it during their lunch hour at work instead of having to block out a whole half day to come in for an exam.
Amazing. That's amazing. Good. Now, on a personal level, how have you kept yourself busy? What have you been doing these past few weeks?
A ton of webinars. So, it's interesting. Initially, when this all started, I had a whole long list of things I wanted to do and how I'm going to read however many books, and I'm going to organize every aspect of the house. I've organized a few closets, and definitely our pantry is looking like a catalog, page out of the Container Store. But it's incredible how the time flies by, and I think the first 2 weeks I spent panic attacked, and just constantly reading up about it and trying to educate myself about it, and really to my own fault in a sense, and causing more anxiety for myself than I needed to. So I wasted the first week and a half that way. And then after that, I kind of fell into a groove of trying to use the time to educate myself with webinars and all those opportunities of education, and also to share my knowledge through webinars and such as this one that you beautifully planned. And then spending time with the family. I've really enjoyed being home, watching my kids through their Zoom classrooms and helping them in that process, and being able to see them earlier in the day. I've cooked every night and only ordered in 3 times this last 6 weeks, which I'm really proud of.
Pretty amazing.
So I think I've cooked more in the last 6 weeks than I have had in my entire life. And exercising and trying to stay connected with family as much as possible, and friends, and through Zoom calls. And we had our first dinner gathering last night with my parents coming over through the side yard, sitting outside. Everyone brought their own food, and everyone took their own trash home. We really tried to keep the distance. Just I think what I have found incredible about this time is how resilient we all are. I mean, I sure didn't think that we're going to be sitting here and talking about the silver lining of this experience.
Yeah.
I mean, for those, and I have had friends who unfortunately have lost loved ones as a result of this. I don't want to minimize the trauma and the incredible loss that this has caused for so many people out there. Knock on wood, I feel blessed that we haven't had our immediate family and circle of friends and my work family affected by this, but the resilience has been really awe-inspiring for me. The fact that everyone I spoke to has found ways to find opportunity through this crisis, whether it's opportunity for personal growth, career growth, connecting with friends, or just with your own mental health and sanity and all of that. So there's reason to smile. I'm going to go back to your program here, because I think in any experience there's beauty and reason to celebrate our wellness. Did you like that? I brought smile, beauty, and wellness.
I love it. And our health. We got to be thankful for our health. So I want to thank you for taking time. I know you have a lot of things going on throughout the day, and I really appreciate it. And I think that our viewers and audience is going to appreciate it. Those who know you obviously already love you, and those who don't, I think will see how smart and brilliant and humane you are. So I appreciate your time, and I look forward to seeing you guys really soon. And for our viewers and listeners, thank you so much. Please make sure that you subscribe and leave comments. And Neda, thank you again.
Thank you so much for having me.
All right. You have a great rest of your day.
Thank you. You too. Bye.